Good day, everyone. My name is Wafa Al-Junaidi. I am a family nurse practitioner student at San Jose State University. In this presentation, I will be discussing the topic of racial disparities within the women of color community and how policies under the Affordable Care Act have a positive impact on improving reproductive health outcomes. Let's begin by discussing the historical context. Racial segregation optimized by Jim Crow laws and redlining played a pivotal role in shaping the healthcare landscape in the late 1800s and beyond. These laws systematically enforced racial segregation, leading to segregated neighborhoods, schools, and healthcare facilities. This segregation had far-reaching consequences that persist to this day. Redlining, another discriminatory practice, further exacerbated these disparities. It systematically denied people of color access to housing, education, and economic opportunities in certain neighborhoods. Furthermore, the unmeasured role of racial bias and systemic racial injustice in reproductive health disparities go beyond individual actions and are deeply embedded in our healthcare systems. Unfortunately, there are significant racial ethnic gaps that encompass disparities in contraceptive use, maternal mortality rates, unintended pregnancies, and more, where women of color have faced unequal access to care. It is also important to mention how eugenic sterilization practices of the past have contributed to physician and healthcare system distrust among marginalized communities. Surgical sterilization was frequently performed without obtaining proper informed consent. Many hysterectomies performed on poor black women with limited medical justification. This practice aimed to secure financial support from the government for such procedures. Understanding these historical roots and the influence of racial bias and systemic racial injustice is essential to comprehending the challenges we face in achieving reproductive health equity for all women. The impact of these historical factors on healthcare access, reproductive autonomy, and overall health outcomes cannot be underestimated. Many organizations are working collectively to decrease the impact of racial bias and systemic racial injustice in reproductive health among women of color. They aim to raise awarenesses, advocate for policy changes, improve access to care, and address social and structural factors that contribute to disparities in reproductive health outcomes. American College of Obstetricians and Gynecologists has recognized the significance of racial bias and systemic racial injustice in reproductive health disparities. They have made efforts to address these disparities by providing guidance and advocating for the elimination of racial bias in reproductive health care. ACA plays a role in raising awareness and promoting equitable access to reproductive health services for women of color. The Center for Reproductive Rights highlights the racial and ethnic gap in reproductive health as a human rights issue. They advocate for policy changes that address disparities by reducing barriers to healthcare access for women of color. Healthy People 2020 emphasizes the importance of eliminating health disparities. It plays a role in setting goals and prioritize for improving health outcomes, including reproductive health among women of color. Disparities extend across various aspects of reproductive health, affecting women of color overall well-being. We see disparities at multiple levels, including individual-level risks and broader social and structural factors. At the individual level, women of color face increased risk for adverse reproductive health outcomes. Clinician biases and stereotypes can also play a significant role in the healthcare disparities. Some studies suggest that women of color may face distrust from healthcare providers, which can deter them from seeking care. Reproductive health disparities among women of color are complex and multifaceted. They encompass individual-level risks as well as social and structural barriers that extend beyond healthcare access. Understanding these disparities at multiple levels is essential as we work toward equitable reproductive health care for all. To highlight an example at the individual level risk, studies have shown that black women experience higher rates of preterm birth and low birth weight neonates compared to their white counterparts. Similarly, disparities in contraceptive use exist. Data indicates that contraceptive use among Black females is statistically less common than among white females. These individual level disparities are intertwined with the broader social and structural factors. Fewer neighborhood health services, limited insurance coverage, and decreased access to education and economic opportunities all contribute to these disparities. Policy interventions are often based on political will and aim to reduce the impact of subjective bias, including individual racial bias and structural racism on healthcare access, acceptability, decision-making, and affordability. One notable example of a policy-level intervention is the Patient Protection and Affordable Care Act, commonly known as the ACA. The ACA was a landmark legislation that significantly expanded healthcare access for millions of previously uninsured and underinsured individuals. Under the ACA, preventive care, including essential reproductive health services, became more accessible to women without copays. This included services such as pap tests, mammograms, contraceptives, sexually transmitted diseases, early screening tests, and more. However, it's important to note that while the ACA made substantial gains, legal challenges have threatened its potential for fully expanded reproductive health access. For example, access to contraceptives, a crucial aspect of reproductive health, has faced ongoing challenges due to federal and state rulings. To achieve optimal reproductive health parity, comprehensive national health insurance reform strategies are necessary to remove barriers and strengthen access. The Affordable Care Act is a landmark legislation that brought about significant changes in the healthcare access and services. The ACA, signed into law in 2010, played a pivotal role in expanding healthcare access and improving reproductive health outcomes for women. As a result, women gain better access to critical healthcare services, leading to improved overall reproductive health. The ACA's provision also aimed to address healthcare disparities among different racial and ethnic groups. Studies have shown that since its implementation in 2010, the ACA resulted in improvement in overall coverage, access to healthcare, affordability, and the use of contraceptives. Access to contraceptives, a crucial aspect of reproductive health, has encountered ongoing challenges due to federal and state rulings. To achieve optimal reproductive health parity, comprehensive national health insurance reform strategies are vital to remove barriers and strengthen access. Despite significant strides in improving women's reproductive health, several persistent challenges remain. Continued legal challenges, legal battles threaten the full potential of healthcare reform, including access to contraceptives and preventive services. Access disparities in access to quality healthcare persist, especially in states that have not expanded Medicaid eligibility. Maternal mortality disparities, which disproportionately affect women of color, remain a public health concern. Clinician biases, implicit biases, and clinician-level issues such as racial bias can impact patient care and outcomes. Historical injustice, such as eugenic sterilization, continue to affect trust in the healthcare system. In the face of these challenges, it's crucial that we remain committed to addressing healthcare disparities, advocating for policy changes, and promoting equity in reproductive health access and services. This slide demonstrates a conceptual model of expanded healthcare access, including reduced healthcare professional bias and potential effect on racial and ethnic reproductive health disparities, which ultimately increase reproductive health equity and decrease reproductive health disparities by ensuring more equitable access to healthcare services for women of color and decrease racism and racial bias equals opportunity to reduce racial and ethnic disparities for women. Finally, I am going to mention the key strategies to address racial and ethnic disparities in reproductive health. We need to focus on comprehensive strategies to addressing racial and ethnic disparities in reproductive health access, services, and outcomes is a critical imperative. We must employ holistic strategies that encompass contraceptive access, maternal mortality prevention, and HIV infection reduction. A crucial aspect of our effort is the development and reinforcement of policies and laws. These measures are designed to dismantle structural racism and combat implicit bias, essential steps in achieving reproductive health equity. We also need social solutions for social constructs. By recognizing that race and ethnicity are social constructs, we acknowledge that the path forward requires comprehensive social solutions. This means addressing disparities at the social level to create lasting change. Thank you everyone. I hope you found my presentation engaging, and I aspire to a future where justice and equity prevail in our world.